Today, we are myth-busting breast cancer with the top 5 breast cancer myths that I hear from patients every day. Number 1, if you don't have a family history of breast cancer, you aren't at risk. This is probably the biggest misconception I hear from my patients. Let's talk about the numbers. About 1 in 8 women in the US will develop breast cancer in their life, and up to 85% of them have no family history. Let's repeat that again. 85% of people with breast cancer had no family history. Number 2, birth control pills cause breast cancer. Birth control pills do not cause breast cancer. There is some data that birth control pills may be related to a small increased risk in breast cancer while taking them and within the 5 years after stopping the pill, but this increased risk equates to an extra 1 case of breast cancer for every 7,690 women using hormonal birth control, and it does not mean the pill caused breast cancer. In addition, your risk goes back to baseline within 5 years of stopping hormonal contraception. We also can't forget that birth control pills significantly decrease the risk of ovarian, uterine, and colon cancers too. Number 3, menopausal hormonal therapy causes breast cancer. This is also false. Again, hormonal therapy does not cause breast cancer, as the cause of any breast cancer is very multifactorial. However, certain types of hormonal therapy may increase your risk of breast cancer. Menopausal hormone therapy that contains both estrogen and progestins increased breast cancer risk by less than 1 extra case per 1,000 women per year. In women who have had hysterectomies who only need estrogen hormonal therapy, the risk of breast cancer actually decreased. Number 4, a common symptom of breast cancer is pain. No, not usually. At diagnosis, breast cancer usually doesn't hurt. Many times there are not symptoms, and breast cancer is detected only on screening mammograms. Other times, breast cancer may present itself as a painless lump in the breast that feels kind of like a rock. Although not impossible, breast cancer rarely hurts. And 5, mammograms are dangerous. I know many people are scared of the radiation exposure from a mammogram, but a screening mammogram is very low dose radiation. To put it into perspective, it's about the same amount as 2 months of background radiation that we are exposed to in our day-to-day lives, or the same as a round-trip flight from New York to LA and back. There are so many misconceptions out there that it can be really hard to tell fact from fiction, but I hope this was helpful to straighten out some of the myths you may have heard.